like a ramus of pubic rami we learned about, something like that, looks like a horn, that's why you call them as ramus. So this back flap we call them as ramus, from the sides is there, and in the front side which is we call them as body. So this two basic part this particular bone has. Now if you look at this particular body, it has some features, the ramus have got some features. So let's talk about the body. It's kind of like having a surface which is known as external surface and internal surface, which is inside the mouth, internal surface of this mandible, and external which is like the skin covered part. So this external surface and internal surface is there, and it has got upper border and lower border. Upper border is having these facets for the teeth. So this particular facets we call them as alveolar process. We call them as alveolar process, where this fits the teeth on it, right? So this upper border and lower border which do not have anything, which is having only bony part. Now this lower part we call them as base of mandible, where it is resting on the base, like base of the lung, similar to that we call them as base of the mandible. So upper border, lower border mandible, if you cannot remember these complex things. So upper border and lower border which is having two surfaces, external and internal surface. Now as things is moving back to this particular projected part which is vertically up with an inclination, we call them as rami or ramus. Now likewise this body will also have two parts, external surface, internal surface, and it has some kind of part which is upper part and lower part. So this ramus meets with the body making an angle. So this point where this ramus meeting with the body we call them as angle of the mandible. This point, angle of the mandible, where it is making a bend, like angle in the ribs where it is bending. Likewise we have an angle of the mandible. So this point we call them as angle of the mandible. So these features that you have to know, ramus, body, and where the ramus meets with body we call them as angle of mandible, this point, right? Now apart from that, this particular bone, the ramus, have got external and internal surface and have got two projections, one projections in front, one projections in the back. The picky one, like which is pointed one, right? This one is we call them as coronoid process, C-O-R-O, coronoid process, and this one we call them as condyle, looks like a hammer which is circular. We call them as condyle, just like condyle of the humerus. So that condyle, condylar process, coronoid process, and in between them we have a notch. This notch goes by the name of it, we call them as mandibular notch. So few things about it, coronoid process, condylar process. Now the condylar process is also known as head of the mandible. So this condylar process we call them as head of the mandible. After the head we have a narrow part, constricted part, we call them as neck of the mandible. Then we have this particular grooved in, we call them as notch. This notch we call them as by the bone, mandibular notch. So in between these two notch we have this particular two process, coronoid process and condylar process. So these basic parts that you have to know about this particular, like the ramus and the body. So this body, superior and inferior borders. Superior borders fits with the teeth, we call them as alveolar process or teeth fishing part. This one, no process, we call them as base. And then we have this particular part, we call them as ramus. Ramus have got like anterior border, posterior border, external surface, internal surface, and two condyles, coronoid process and condylar process. In between them we have a groove, mandibular notch. And these condyles we call them as head, and below head we have the neck which is constricted part. So this condylar process makes a joint, this jaw joint we call them as TMJ, Temporomandibular Joint, which is joining with this temporal bone making a joint. This joint we are referring here. So this particular bone we call them as temporal bone, and this particular joint which is joining with the mandible, temporal bone with the mandible bone, Temporomandibular Joint. In short we call them as TMJ. So this TMJ is a jaw joint. Basically we are making this particular joint movement up and down, flexion and extension, little bit like protraction, retractions, and little bit like sidewise movement that can be taking place. So movements of this particular temporomandibular joint, we have a special class or a theory class, we will learn about that in in those classes. Now, so these are the basic things that you have to know. Now, little bit on this particular contributing to this particular, apart from these basic things, little bit more in parts about this particular body. In the body, in the midline, we have a fusion line where this right side half of the mandible, left half of the mandible unites. So, we call them as symphysis point. So, symphysis pubis, in case of this we call them as symphysis menti by this mandibular, which is the midline bone, a kind of union point, which you can see that right side mandible meeting with the left side mandible making a common joint, we call them as whole mandible. This meeting point we call them as symphysis menti, right. Now, on this external surface of it we find a foramen, we call them as mental foramen. By this symphysis menti we call this anterior foramen, we call them as mental, M-E-N-T-A-L. So, this mental foramen which is present visible externally from the external surface runs through some content or runs through some neurovascular structures. So, out of these two things that we have to keep in mind related to this particular symphysis menti, and these 2 points we call them as foramen, mental foramen. Now, if you flip it, go to the inner side, it's the inner side of this particular body is divided into upper half and lower half by an oblique running line. We call this line as mylohyoid line by a muscle. We call them as mylohyoid, M-Y-L-O-H-Y-E-I-D. Hyoid is a bone and this particular mylo is a kind of like a muscle which is attached to it. So, we call them as mylohyoid line, which is splitting this inner side of the body of the mandible into upper part and the lower part, right. And in the midline, just where you see this particular symphysis menti is there is a depression. We call them as digastric groove. Where is a muscle attached to it, we call them as digastric, D-I, gas by the stomach, gastric. So, this digastric groove and mylohyoid line, these are the two inclusion of things related to the inner part of this mandible. Mylohyoid line which is running obliquely, we can just like figure out this line, and a groove and on this particular symphysis menti and into this part where I am holding it, these points right and left we call them as digastric groove, okay. And this mylohyoid line splits these things into 2 parts, but I do not want to make it complex, but mylohyoid line and digastric groove is good for us for at this point. Now, in the inner side, just like outer side, we have a foramen, we call them as mental foramen. Likewise, in the inner side, where this particular ramus meets with body, we call them as angle of the mandible. Inner side on the angle, we find another 2 foramens, right side and left side, interior to it. We call this foramen as mandibular foramen. So, we have a foramen inside at the ramus, which is directed towards the angle of the mandible, we call them as mandibular foramen, which is starting below the notch. What notch is there? Mandibular notch. Below the notch, we have a foramen, we call them as mandibular foramen. Where we are going to find this mandibular foramen? Where the ramus meets with this body, that angle, that point we have a foramen. Now, if we trace this foramen, mandibular foramen to this mental foramen, we find a canal. So, this foramen is an entry and this is exit route for some neurovascular structures. So, something going in through this foramen. What foramen? Mandibular foramen, and that structure gets out of this foramen, mental foramen. So, it runs along this track or kind of like a groove through this particular canal. So, we call them as mandibular canal, which is present in between them, but mandibular foramen and mental foramen. Now, this canal groove, we do not see it. So, we better not talk about it right now. So, these 2 foramens, 2 condyles, 1 angle, 1 notch, 1 border, which is alveolar process meeting in, and the base of the mandible that we have to keep in mind. Now, whenever you are holding this anatomically, you have to know how to hold this anatomically. This is a single piece of bone, so right left does not have any mix up with us. Now, whenever you are holding it, you have to make sure this alveolar tooth facing process should be facing up. So, this is a superior border, and this condyles or this coronoid process and the condylar process should be facing up, and this mandibular notch which is going up, and this angle of the mandible should be facing back. So, this condylar notch along with this particular angle which will be on the back side, and this particular bone you have to hold in both hands, right side, left side, and the midline like this. So, this is an anatomical positions. If you are holding it in normal anatomy, above, below, lateral part, this part side of the body of the mandible is external side, will be externally placed. Mental foramen, which is should be visible from the front side or external side. Mandibular foramen, you should be able to see the mandibular foramen whenever you are holding it. So, external or the examiner will be seeing this foramens externally, you should be seeing this mandibular foramen. Clear? So, coming again, two parts, body, ramus, joining between angle, body, upper border, lower border, alveolar process for teeth, lower border, externally, midline, symphysis, Menti, symphysis pubis. By the side, we have this, we have a groove present in the inner side, we call them a digastric groove, which is inching to this base over here. So, digastric groove present on this part. Then we have foramen, mental foramen, which is present in the parts or mix of this body. Then moving to this ramus, ramus anterior border, posterior border, medial side, lateral side. Now, in between these two projections, we call them as anterior one, coronoid, condyle, in between them, notch, mandibular notch. Inside to the mandibular notch, we have a foramen, mandibular foramen, and then from the mandibular foramen runs a line, we call them as mylohyoid line. It splits this mylohyoid line above and below. Two parts are there. So, we will talk about that in two parts about these particular regions. So, it splits this into two regions. Now, coming to this particular ramus, where this ramus meets with this particular body, we call them as angle of mandible. So, these are the things that you have to understand into this particular bone, basic understanding on this particular bones which have got present to it. Now, this particular bone have got few muscles attached to it that we have to understand. So, very few muscles are very prominent muscles are attached to it. So, muscles that are attached to this mandible, they are muscle of mastication. Mostly, they are muscle of mastication. That means they are helping to chew this food content over there. So, this muscle which is present on the external side, if you clean your teeth, you can make this muscle taut, this muscle. So, this muscle we call them as masseter, this one. So, this masseter is present in the ramus on the outer side or the lateral margins. So, this ramus into which you have a muscle attached, we call them as masseter. So, this ramus have a muscle attached on the body of it, side of it, we call them as masseter. Now, on into this particular muscle which you are seeing here on the top, coronoid process, where it looks like a peak of a mountain, we have a muscle coming from above. From here, it is massing over here, we call them as temporalis. Again, if you clench your teeth, you can see this muscle contracting over this temporal region, and now clench it, you can see, you can feel the contraction of muscle here. This muscle, if you are chewing it, you feel it. This muscle we call them as temporalis. It is coming from this temporal region and anchoring to this point. Which point? Coronoid process, mandibular coronoid process. So, these two muscles, masseter and this temporalis, coming from temporal bone, on top of it, it is getting into this particular bone. Masseter, temporalis. Now, there are two muscles are there. They are known as pterygoids. They starts with P, P-T-E-R-Y, pterygoids. Now, these pterygoids helps this jaw to move forward and backwards. Forward, backward, protraction, retraction, just like the scapula, protraction and retractions, forward and backward bending of or movement of this. So, these pterygoids are two of them are there. We call them as medial and lateral. So, the medial and lateral pterygoids, they are attached on this particular bone. We call them as angle of this mandible, which is lying below this part. Here we have attachments of the lateral pterygoid. Lateral pterygoid is encircling around the head part, or below the head we have the neck part. So, we have the neck which is present, we call them as lateral pterygoid, and medial pterygoid is covering at the lower part over this angle of the mandible. You see the angle of the mandible? Inner side around this region we have this pterygoid which is medially placed. So, medial pterygoid, lateral pterygoid. So, pterygoids medial and lateral, they are present on the neck region and this ramus inner side. Opposite to this particular muscle which is attached in here, we have the masseter. Inside we have the medial pterygoid, above lateral pterygoid. So, these are the four muscles that is very important for us to remember: masseter, temporalis, medial and lateral pterygoids. They are muscle of mastication. That means they are helping us to chew the foods by flexion and extension and forward and backward retractions of this movement of the temporomandibular joints. Clear? Along with that, we have some muscles attached to it. What muscles? On the mylohyoid line, we have a muscle attached. We call them as mylohyoid. We call them as mylohyoid. So, this muscle which is attached to this mylohyoid line, mylohyoid, alright. In the digastric groove, a muscle attached, we call them as digastric. Now, digastric muscle have got two bellies, we call them as superior belly and anterior belly and posterior belly of digastric. So, this bellies of the digastric, the anterior belly of digastric muscle is attached to this particular point which is on the digastric groove. So, mylohyoid muscle. Digastric groove muscle attached to it is called them as digastric. Clear? Along with that, anteriorly over this foramen, which foramen? Mental foramen. We have a muscle attached along with it, along with this border, we call them as buccinator. Along with this, we call them as buccinator, which is puffing muscle. This muscle which you are making a blow, this muscle is attached on this side, cheek muscle. This is not a muscle of mastication. These muscles are muscle of facial expression. Whistling muscle, we call them as buccinator. So, this muscle is attached on this particular point, we call them as external buccinator, buccinator. So, this buccinator is attached on this. Along with that, we have geniohyoid, etc., other muscles attached to it. We have one superficial muscle attached on this margin, we call them as platysma. Platysma is a neck muscle which is present on the superficial part. So, this muscle, if you are contracting, we call them as platysma, which is used for shaving. Male person use that, making it taut for shaving. The shaving muscle in the neck region, we call them as platysma. So, these are the other muscles related to it, but we cannot forget the four muscles of mastication. This one, masseter, this one, temporalis, and medial and lateral. These four muscle of mastication. And then we have this digastric groove muscle, digastric, mylohyoid and buccinator. Along with that, we have other muscles attached like platysma, geniohyoid, but anyways, we will be learning that later on. So, basic thing we will be knowing about it. Alright. Now, one last thing before we end. Through this foramen, mandibular foramen, we have a nerve runs through it. We call them as inferior alveolar nerve. By the alveolar process, we call them as inferior alveolar nerve and inferior alveolar vessels. Inferior alveolar nerves and the vessels which runs through it. And what comes through this particular foramen, we call them as mental nerve. Now, inferior alveolar nerve, inferior alveolar vessels, we will be learning that where from it is coming. If you can remember this, it's fine. If not, when you come to the head and neck anatomy, we will come again about this foramen. But you must not forget the name of the foramen. This one, mandibular, and this one, and they are connected, right? What gets in should come out of this, but the name changes. But anyways, to continue this whole thing once again, two parts, body, ramus. Body, external surface, internal surface, upper border, lower border. Lower border is also known as base. Now, this base is continued backside, we call them as ramus. Ramus and the body meets at the angle, we call them as angle of mandible. Ramus have got two surface, external, internal. have got upper border and lower border. Upper border have a notch and two projections, anterior, posterior. Anterior one coronoid, posterior one condyle. Condyle is also known as head. Under the head we have constriction, we call them as neck. The head makes the joint TMJ, Temporomandibular Joint. Coronoid process makes no joint contribution. In between them, angle, mandibular notch. Now then we have this inner side, under the notch we have this foramen, mandibular foramen. From where the line starts we call them as Mylohyoid line, and then on the midline we have externally a midline bar, we call them as Symphysis, Menti. Under to this point we have depression, we call them as Digastric groove, and then we have this externally foramen present which is communicating with this mandibular foramen, we call them as mental foramen, right. And then we have the muscle attached to it, Masseter externally, here Temporalis, here Pterygoid medial, lateral, Mylohyoid line, Mylohyoid, Digastric groove, Digastric, and then externally we have a muscle present, buccinator. At the angle we have a muscle attached, we call them as platysma. Along with that we have small muscle, we call them as geniohyoid, which is anchored to this. So these are the prime 6-7 muscles that we have to keep in mind. Holding this bone anatomically, above and below identified by the alveolar process, below is by the base, and the condylar process is on the posterior side, which is continued down as the angle, which had to be held in the back side. So whenever you are having this Symphysis Menti forward and grooving it like in this particular anatomical position with both hands placing at the angle of the mandible. There are few ligaments attached to these particular bones, but at this level, once we start the anatomy, then we will have to know about some ligaments related to this particular bone. Beside these particular joints, we will talk about those ligaments like sphenomandibular, mandibular ligament, which are developmental relevant ligaments. We will talk about this later. So this is about this particular bone that you have to remember this salient features later on you have to. So 10-minute study time should be given to this particular bone, which basically covers all these particular general features of the bone. Later on, deep digging if it is required, afterwards we will deal later. Alright. Second half we will assemble for the like a revision class for the embryological classes, whatever things we covered. I will give a short brief review of the GI system and reproductive and the renal system, whatever the embryology things which is have been covered to this semester. And tomorrow we will take a like off physiology, probably we will take this particular physiology class in anatomy classes place. We will see, we will confirm it how these things are going on. And for the anatomy syllabus is covered, or more than things we have covered already. The theory and the practical part will be like the same, and you have classes on Monday and Tuesday as well. No study breaks given this time, or you have a break like given in a study break. No study break till Friday you have class. Till Tuesday, right? Till Tuesday. Anatomy is on Wednesday. All right. Okay. So without holding you back for this study, whatever things is there, and if you come in the second half 2 o'clock around this lecture class, we will talk about this review of summary of the GI embryology and renal embryology and reproductive embryology. All right, thank you.